Hi, today we have a lovely lady who wants to have a nose operation. As you know, for the nose operation there are two components. One of them is the aesthetical problems and the other one is the functional problems. This lady has both of these problems. We are going to check her pre-operative photos and talk over these photos, define problems as precise as possible. We will later address those problems to solve them as effective as possible. So, when we check her pre-operative photos from the frontal view, the most significant problem is she has a very wide nasal base. The dorsal aesthetic lines should be parallel to each other on the mid part of the nose, and it is kind of projection of the eyebrows over the nose itself. So when we check these properties on the frontal view, we see that her mid-nasal part is very wide. Her nasal processes of the maxillary bone are very wide. In addition to this, she has a very wide nasal tip. She has a septal deviation, which causes a slightly curved nose, which is concavity looking rightwards. She has unproportionally large lower lateral cartilages, which gives a very broad and wide tip appearance for her face. This is the side view of the patient. The most disturbing problem on this view is her nasal tip is pointing downwards. This is mainly because of the lack of support on the tip region of the nose, as well as kind of malrotation of the lower lateral tip cartilages. We need to redefine that LLC, the lower lateral cartilages, and we need to support the tip of the nose to increase its projection and its major support to make it more projected and slightly lifted upwards. On the side view, another significant problem is she has a very prominent nasal hump. It's partially because of the bone and partially because of the cartilaginous compartment on the supratip region. So during our operation, we have to carve out, we have to trim out this extra section that's causing the nasal hump. We can also see that nasal wings, I mean the alar part of the nostrils, are very prominent, which means that there are certain attachments between the facial muscles with the nostrils, so we have to release that attachments as much as possible. This is the bottom view of the patient. You can clearly see that there is lack of support of the tip that's leading to this collapsed nose appearance, which you can see as if the nostrils are totally collapsed over the rest of the nose, giving that extra concavity at the base of the nose. Even without doing any operation, in this view, we can see there is a relative collapsed appearance of the nostrils. Therefore, during our operation, we have to address that problem by increasing the support of the tip of the nose, by putting strut cartilage grafts to increase the projection of the nose, to increase its height, and by just doing so, we will change the shape of the nostrils. But I highly expect that since we need to do a nasal reduction for this patient, we would end up with decreasing the size of the nostrils as well. Finally, that's the oblique view of the patient. You can clearly see most of the problems that I mentioned before. The most significant one being the down-pointing tip, the lack of support of the tip. You can see the bony and cartilage hump that we're going to exercise to achieve a sloped dorsum. We're going to correct the malrotation of the lower lateral cartilages to change the shape of the tip, and this nose shape is going to change significantly at the end of the operation. We have just performed our surgery without any problems, and we've checked our patient. The first week after the operation, usually our patients have too much swelling. The most valuable photos are the ones after the second week after the operation. So now I'm going to evaluate the post-operative and pre-operative photos depending on the early post-operative photos on the second and third week after the surgery. Here you can see the third week post-operative photo of the patient together with its pre-operative photo. You can definitely see that we have shortened the nasal length, so we have shortened the nose as a whole. We have corrected the malrotation of the lower lateral cartilages to restore the angles of the tip cartilages. We have lifted the nose at least 3 millimeters upwards. There was no supratip break before the operation, so we have created a supratip break for a much more natural transition from the tip of the nose to the dorsum, and we have rasped out the cartilage and bony hump to achieve the sloped dorsum. And from this oblique weave you can see the significant interventions that we've done during the operation. That's the side weave of the patient. If you check the pre-operative and the post-operative third week results, you can clearly see that we have shortened the nose. When you check the pre-operative photos, the angle between the columella and the philtrum, which means the nose and the upper lip, was around 80 degrees before the operation. We have lifted the nose to make this angle at around 110 degrees immediately after operation. So this is called as the nasal tip lifting, but this lifting is much more visible within the first few weeks after the operation. We do a slight overcorrection that within the following 2 or 3 weeks we expect the nasal tip to come down to a much more natural position. And as you see, before the operation the nasal hump was continuous with the nasal tip. There was no supratip break over the nasal tip, but immediately after operation you can see a very nice supratip break over the dorsum of the nose, and we have achieved a very nice sloped nasal dorsum. Finally, that's the bottom weave of the patient. You can see the pre-operative and post-operative results that just by increasing the support of the tip of the nose, we have corrected most of the problems about the nostril shape. And as we just planned before the operation, we have done the nostril reduction. By this nostril reduction, together with increasing the support, we have corrected most of the problems about the bottom weave, and we have achieved more or less an overall symmetry between the right and the left side nostrils. And when you check the pre-operative and post-operative results, that's a pleasing early post-operative result after the operation. Okay, in this video we have evaluated a patient's pre-operative photos. We made the surgical planning, and then we visit the operation room, and then we check the early post-operative photos of the patient to give you an opinion about what you should expect during the course of the surgery as well as the early follow-up period. I hope you enjoyed this video. Thanks for watching.